Good morning, Excellencies, distinguished guests, colleagues. Good morning, ladies and gentlemen. It is an honor to be here today. I would like to thank the organizers for inviting UNESCAP to participate in this very important meeting. I'm going to present an overview of trends in population and aging in Asia and the Pacific, and also summarize the work of UNESCAP in this field. As you know, UNESCAP stands for the Economic and Social Commission for Asia and the Pacific. It is a regional development arm of the United Nations based in Bangkok, Thailand. It is made up of 53 member states and 9 associated members with a geographical scope that extends from Turkey in the west to the Pacific Islands in the east, from the Russian Federation in the north to New Zealand in the south. The region is home to 4.1 billion people, roughly 2/3 of the world's population. This makes ESCAP the most extensive of the United Nations regional commissions. With a staff of over 600 people, it is also the largest of the UN bodies serving the Asia-Pacific region. We were established in 1947 to help overcome the many and considerable challenges facing the region and providing norm-setting work, capacity development, technical assistance, and research and analysis. I'm leading the work on population and development issues. I would like to make it clear from the start that population aging is a human success story, a story of a greater number and a greater share of the older population living among us. The many faces of older persons in Asia and the Pacific, indeed all over the world, attest to this fact. People are living longer and very often healthier lives, surrounded by family and friends and enjoying the fruits of their labor. They all live among us, and some live with us in multi-generational households. They're part of our daily lives, and we are part of theirs. However, the steady and sustained growth of older persons poses some new challenges. There's a challenge to those who must look after themselves on a day-to-day basis while struggling, for example, with non-communicable diseases, which are on the rise. There are those policymakers who are trying to find ways to provide pensions and health care to older persons. And then there are also the caregivers, often women, who are looking after their elderly parents. Population aging refers to the increase in the share of the older population in the total population. It goes back to the 1900s when overall health of the population increased and people started living longer lives. Over the same time interval, fertility, measured as the number of children per woman, started to decline from levels of 5 and 6 children per woman to lower levels, such as 2.1, replacement level. This increased both the number and the proportion of older persons in most of the world's countries. This population aging is a direct consequence of the demographic transition. Let us focus first on the total number of persons, older persons in the world. The global population aged 60 and over stands at 962 million in 2017, more than twice as many in 1980. The number of older persons is expected to double again by 2050, reaching nearly 2.1 billion people. Asia leads the world in sheer numbers, 549 million older persons in 2017. Some 60% of all older persons in the world are currently residing in Asia and in the Pacific. Now let us focus on the percentage share of the older population in the total population. Again, in Asia and Pacific, in 2017, 1 in 8 people in Asia were 60 years or over. By 2050, this number will have increased to 1 in 4. You can see this in the chart by following the yellow-orange line. Most of today's developed countries have had decades to adjust to changing age structures. For example, It took more than a century for France's population aged 65 or older to increase from 7 to 14%. Many developing countries experienced a sudden rise in the number and percentage of older people, often within a single generation. If you focus, for example, on China or Korea or Singapore in the chart, you will see that for them it is projected to take 20 to 15 years. This was often fueled by dramatic drops in fertility levels during the last decades. In response to the compression in aging, institutions in developing countries are called upon to adapt quickly to accommodate to new age structures. It is often said that developed countries grew rich before they grew old, while many developing countries may grow old before they grow rich. Okay. What I've described so far can all be expressed in a population pyramid, which gives you the population by age and sex. On the horizontal, you will see the percentage of the total population, and on the vertical, you see the age groups. What I'm showing you here is a population pyramid for 2000, which is a relatively broad base, and this is shown for Asia and Pacific alone. Now I'm imposing other pyramids on top of this. This would be one for 2015, and you see that the base is already shrinking, and there are more people in the labor force and in older population groups. And now I'm putting the one for 2050 on top of it, which is the one projected for Asia Pacific, and you see a much smaller base and a greater percentage of the population in the higher age groups, and you also see that there are more women in the older age groups. Just 5 countries accounted for half of the world's population aged 60 or over, and 4 of them are in Asia Pacific. We see China, India, Japan, and the Russian Federation. So population aging is a very important topic for the region. Population aging also has a gender dimension. Women comprise the majority of older persons because they live longer. This is a chart for Asia and the Pacific, again, showing the population by age and sex for 2019. And as you see, if you focus on the older population groups, those above 80 and plus, you see that the share among women is much higher. This gender balance at older ages has many implications for population and individual aging. Focusing on women, older women are more likely to live alone. They live longer, as I already said, and they will often be left behind because their husbands might have passed away, children have moved away, and also families are shrinking. There are fewer kids around. So women are often left behind, having to look after themselves. Women are also less likely to have an income, savings, own land, or have a pension. Older women often face barriers regarding accessing health care, some of this due to cultural reasons. Older women are more likely to be subject to neglect and abuse, as we already heard, than older men. Overall, population aging also has impacts on younger women who are often looking after their elderly parents. And these younger women are also in the labor force very often, so they have a double burden, if you want. They need to look after their older parents and work, which is quite challenging to them at times. Another important aspect I want to highlight is about where the older persons live in regards to urban and rural areas. The older population is increasingly concentrated in urban areas, as shown in the following graph. I'm contrasting data for 2000 and 2015, and I'm looking at the population 60 years and over and 80 years and over for different regions of the world. If you look at the yellow line, you will see Asia and Pacific. And here, you will see a significant increase in the percentage share of the older population living in urban areas. As we have heard so far, there's a global guiding document on population aging, which is the Madrid International Plan of Action on Aging. It was adopted in 2002 and has been followed up ever since. There were 2 or 3 priority areas. Number 1, older persons and development. Number 2, advancing health and well-being into old age. The third one was focusing on ensuring enabling and supportive environments for older persons. Let me just identify a few topics that would fall under these priority areas. In the area of older persons and development, it is important to recognize that member states committed to reducing poverty among older persons, ensuring income security and social protection. They felt that participation of older persons in decision-making is crucial. They discussed employment opportunities and making employment for older persons an option. Reducing poverty, intergenerational solidarity, equal access to food and shelter and medical care are some of the issues that were addressed under the first priority area. Under the second priority area, focusing on aging and health, it was identified that there should be universal access to health care, but also special needs of older persons were identified, such as mental health needs or disability needs. Strengthening the long-term care and primary care was an issue, and also training of care providers and healthcare professionals was identified. And the third priority area focused on housing and living arrangements that would have to be created to make them more age-appropriate. Aging in place was discussed, and also looking after the caregivers. As I mentioned, the Madrid International Plan of Action was adopted in 2002, and so far it has been reviewed 3 times. Often there is a regional review that will feed into a global review. As you can see in the following slide, the last review in the region in Asia Pacific was conducted in 2017, and that was followed in 2018 with a global review at the 52nd session of the Commission on Sustainable Development. The question is, what will happen in 2021 and 2022? It might be another review of the MIPA, possibly in the context of the 2030 agenda, and here we are, of course, in the hands of member states to take this forward. MIPA and the 2030 agenda are closely connected. The 2030 agenda is a holistic agenda, emphasizing the need to leave no one behind. MIPA and the 2030 agenda are complementary. MIPA provides a more detailed action plan and will support the 2030 agenda. Let me identify a few SDGs that clearly speak to population aging coming out of the 2030 agenda. SDG 1, no poverty. SDG 2, ending hunger. SDG 3, focusing on health and the well-being of older persons. SDG 5, gender equality, very applicable to older persons as well, older women. SDG 8, focusing on economic growth and decent work. 10 and 11 on inequalities and sustainable cities. All of these are just a few examples coming out of the 2030 agenda that very much apply to older persons. Social policies become even more important in aging societies. Universal access to healthcare is important, and social protection, providing decent employment opportunities for all, and lifelong learning. All of these are objectives of the 2030 agenda, and they apply to older persons. Let me say a few words about pension schemes in Asia and the Pacific. Largely achieved through economic growth, poverty reduction in Asia and the Pacific has been impressive over the past decades. However, poverty reduction was also so effective because it targeted low-hanging fruits. Future poverty reduction will depend on to which extent countries will be able to reach the furthest behind. Older people are among those at risk of falling into poverty when they can no longer work. Older persons often have no income or lower incomes than people at working age. If the proportion of older persons increases, income inequality is likely to increase as well. This is exacerbated by the fact that pension coverage, as you can see in the following graph, is low in many countries in the Asia-Pacific region. Thus, in many countries, most older people have no income security, and women are even less likely to be covered. Thus, the way pension systems are currently designed, they tend to perpetuate and exacerbate often existing inequalities. Those who already have a more stable position in the formal sector are more likely to be covered by a pension, while those in the informal sector are typically not covered. Many older persons still have to work out of need, and many of them are employed in the informal sector with very low incomes. What is ESCAP doing in this regard? Of course, we engaged in follow-up and review of the Madrid International Plan of Action and have been doing this on a regular basis with partners in the region and at the global level, including, of course, UNFPA. We're also focusing on population aging and ICTs. Information communication technology can improve the lives of many of us, but also of the older persons. And here we're working with partners on using ICTs to, for example, improve health situations of older persons. We have some projects in that regard. We're also engaging in capacity building on measuring population aging. What is an older person? How is it defined? Is it 60 or 65 plus, or is there another way of looking at older persons in terms of how they are defined? As already mentioned, we're working on an active aging index with Professor Zaidi, focusing right now on ASEAN countries, a measure that will help us to follow up more closely on the implementation of the Madrid International Plan of Action on Aging. And of course, we are engaged in research and analysis of levels and trends in population aging in Asia and the Pacific, including capacity development on pensions. The population aging agenda is an agenda for all generations. Recognizing older persons as agents of change is very important, and they're contributing sustainable development in many different ways. Not singling out an old person per se, that is important, but to focus, as we have already heard, on a life course approach to aging. Addressing population aging and implementing the MIPA, the Madrid International Plan of Action, requires comprehensive policy actions in the context of the 2030 Agenda involving all generations, which include, and let me repeat, broadening the scope of social protection to reduce poverty and income inequality, including those of older persons, ensuring healthy lives and promote well-being at all ages, providing employment opportunities for all, especially for older persons who want to work, addressing all forms of discrimination and abuse, especially also focusing on women, harnessing the demographic dividend where it is still available or can be made use of, depending on the status of the demographic dividend in particular countries, and promoting research, use of technology, and data, especially disaggregation of data. Living longer and healthier lives brings tremendous potential for social and economic development and personal fulfillment all over the world. ESCAP stands ready to support countries in further implementing the MIPA and also the 2030 Agenda and helping you to focus on population aging. Thank you very much.